Hello, people of YouTube. It is me, Lil PS Fan, and yes, you read the title. This dog and I are going to be surgery buddies. Yay! But what does that mean, you may ask? Well, let's start with Scrubby. Scrubby here is a miniature schnauzer, and he has a condition called that, where, now children cover your ears, when a male dog goes through puberty, both of their testicles must drop. However, because this doggy right here has that condition, that means that only one of his testicles dropped and the other one is still inside of him. And this condition can lead to testicular cancer, which, of course, is not good. And if he were to ever get a female pregnant, her male puppies would also have the condition, and they, in turn, could also be at high risk for testicular cancer. So, just to be all around safe and prevent any kind of cancer in this boy, he is going to be neutered. And his neutering will, cost a little extra because it's not a normal male neutering like this one has had. Haven't ya? But the end result will pretty much be exactly the same. And he is going to have his surgery done on the 1st of December. And in case you remember, back in 2013 in a video I had our dog Scrub, which was also a miniature schnauzer. This is Scrub. He is the oldest. It goes him, Sassy, then Pal. He's the oldest, and he is a schnauzer, and he is blind, and runs into stuff all the time, and is scared of storms. Yeah, poor boy. But he died a while back due to just old age, so this little guy is Scrub Jr. And if you could not go blind like Scrub Sr., that would be great. So that is his surgery, but what about mine? Well, back in 2010, when I was 10 years old, I broke my knee by falling out of a tree. And I have not climbed a tree since. But ever since then, I've had trouble with that knee. And since then, it felt like I have torn my meniscus 3 or 4 times. I find later out that that's not how meniscus tears work. When you tear the meniscus, it stays torn. It does not heal itself. But you can have physical therapy to make it to where it just doesn't hurt anymore. And when I've torn my meniscus, after a while, it felt like it got better. So, when I fell again, and when I felt like I had torn my meniscus again, back in late July, early August, the pain has gotten better to where I can walk on it, but it still hurts. And after getting an MRI, I found out I had a radial tear in my meniscus. And talking to the doctor, I found out that when I've felt like I've torn my meniscus again, in actuality, I've just been making the tear a little bigger and bigger each time. So I just decided enough is enough, do surgery on me. And how the surgery goes is basically they take the part that's torn and they just cut it off. Then they do a little sanding and shave it down. And on the 3rd of December, I'm going to have my pre-operation visit with the doctor, and then I'm going to have my surgery on the 4th. It'll take about a month to heal, but really the surgery's not that big of a deal, because this is the type of surgery where you have surgery that day, and then after a little bit, you can go home the same exact day. So don't worry, it's fine, everything's fine, I'm gonna be fine. Of course, there's always the possibility of me dying, but that's true with basically any surgery. So really, there's absolutely nothing to worry about.
Medical terminology, this is called anesthesia awareness. Is if a patient wakes up, can feel pain, but because of the paralysis, the patient cannot report it. In this case, the dose of relaxants is sufficient, but the other components of the anesthesia are not. This can cause tremendous suffering to the patient. And after the operation, the patient will, most likely, have to struggle for an extended period with such things as general stress, mental disorders, insomnia, and nightmares.
Oh. Wow.
Learned all the horrors of anesthesia awareness, one could, of course, refuse to have operations. But this shouldn't be done, especially when there are strong indications of the need for surgical intervention. It should be remembered that the probability of awakening under the scalpel is a negligible 0.008 to 0.2% of all operations. And in approximately 80% of all such cases, even after having come to, the patients don't remember anything.
Oh, well, that's good at least. And what's funny is, back in 2010, I had my tonsils and adenoids taken out. So I guess I'm just trying to make it a thing. Every 10 years, I'm gonna have surgery. And no, we did not plan to have our dog's surgery and my surgery around the same exact time. It just kind of happened like that. So he and I will be covering from surgery around the same time. Hence, surgery buddies! Yay! So that is the story of how I met your mother. So there's probably not going to be any videos for a while I'm recovering from surgery. But don't worry about me or the dog. We're going to be fine. But yeah, guys, that's the story of how my dog and I became surgery buddies. Thanks for watching. See you soon. Bye!